Tareq Azzoum joins us live now from Deir el-Balah in central Gaza. Tareq, hospitals clearly struggling to cope, as we saw in that report, under so much pressure, trying to keep up with the number of children, as you said, with malnutrition. And it's, as one of the experts said, it's forced starvation here.
Yeah, that's correct, Sarah. Hospitals are still really struggling in order to deal with high rates of malnutrition, as Gaza's health ministry continued to release medical reports suggest that rise completely contributed to the ongoing ban of aid supplies entry and many life-saving medical supplies and nutritional elements to already a strict population, including the most vulnerable groups. And in order to know more about what has been going on inside Gaza's hospitals, I'm joined right now by Dr. Hannah Grace. She is a paediatric volunteering with Panzima. Thank you so much for joining us today, Dr. Hannah. I'd like from you to know more, firstly, to start with the first question about your first impressions upon arriving in Gaza and seeing the wide-scale level of destruction across the Strait during your visit.
I think before coming here, you see pictures, but nothing can prepare you. When you arrive, Gaza is completely flattened from what I have seen. Lots of the buildings are only half standing and many of them are completely destroyed. And it goes on for miles and miles and miles. So nothing, it's just unimaginable, really.
And could you tell us more about the current conditions in Gaza's healthcare facilities and challenges doctors face to treat patients in light of the scarcity of medical supplies?
Yeah, so the doctors and nurses here are working so hard, they're exhausted, they're working 24-hour shifts, and many of them are living in tents themselves and then coming in to deliver the best care they can to their patients. When mass casualties happen, the hospitals are completely overwhelmed. There's not enough beds, there's not enough staff to treat them. Patients are on the floor, two patients or three patients to a bed, and the hospital is completely overwhelmed. There's not enough cannulas, not enough dressings, not enough antibiotics. Many patients and small children are being treated for extremely painful explosive injuries and burns with no pain treatment at all because it's not available.
And could you tell us more about the kind of injuries that you have witnessed during your 4 weeks visit to the Gaza Strip and how they are really treated and this severe shortage?
Yeah, so many of the injuries are explosive injuries, gunshot injuries, very severe injuries needing surgeries, lost limbs, lost arms, legs, severe burns to the chest and the face, and in small children. One 3-year-old came in last week to our hospital and his whole entire family had been killed in an airstrike on his home, and the 3-year-old was the only survivor and he had severe burns as well, so now he is left without a family. There's not the burn specialist here to treat him, there's not the fluids, there's malnutrition, so there's no food for him to have, so meaning the burns will take much longer to heal. Because his body is not able to survive on the nutrition he's getting.
And could you tell us more about the most traumatic scene that you have witnessed during your visit and how it has affected you personally?
Yeah. One of the most shocking and upsetting things I've seen is a lady that was 30 weeks pregnant. She came in after being in an explosion in her tent, and shrapnel, which is small pieces of metal from the bomb, had gone into her chest and her abdomen and cut through the abdomen and cut through the unborn baby. So they removed the baby, which I saw, and the unborn baby itself had been cut through its abdomen and its leg and did not survive. So that was really shocking to see.
It's very horrific testimonies, and thank you so much for sharing your time with Al Jazeera English. So, Sarah, it's not just about malnutrition, it's about an unprecedented surge of casualties, different kinds of casualties, in fact, resulted from the Israeli wide-scale military campaign that continue to really trigger massive repercussions, not just on the humanitarian level, but on the medical one, as hospitals continue to battle to save lives amid the very severe shortage of all kinds of medical supplies available and the ongoing restrictions on its delivery to the territory.
And as you're saying there, these ongoing strikes, Tareq, because we've had at least 68 Palestinians killed just on Sunday alone, and it seems to be an increased focus on northern Gaza. Describe to us the situation there.
Yeah, it has been a very continued pattern across the Gaza Strip as the Israeli military is still pressing on with its military offensive across multiple fronts in Gaza. And over the past a few hours, we have heard a series of deadly explosions coming from the city of Khan Yunis, which has been an active epicenter for the latest ground operations, and with more reports growing regarding battles between armed factions and these ground forces operating there to destroy the city of Khan Yunis. But we have actually observed a surge of airstrikes, especially in northern Gaza, in particular, to be more precise, on a Shati refugee camp where 5 civilians were killed after a drone struck a group of people were walking in a very busy and densely populated streets. Also, Gaza's health officials continue to report that 1 Palestinian was killed and approximately 29 others were reported injured after they were approaching aid distribution centers operated by the controversial Gaza Humanitarian Foundation at the Netzarim corridor, which is only a few kilometers away from where we are. And there has been a clear use and activation for drones and fighter jets since the early hours of this morning to pummel residential areas alongside the eastern edges of the central areas, including Al-Maghazi and Al-Barej refugee camp. Actually, this all is unfolding at the moment while Gaza is still suffering a very impending humanitarian crisis, and civilians have been told repeatedly to move to areas designated to be safe for them. But all the witnesses and the testimonies that we managed to gather from people on the ground reflect a very unmistakable reality, which is no place across the territory is apparently safe, Sarah.
Yeah, exactly. Thanks very much, Tareq Azzoum, there, just giving a sense for us of what is happening on a daily basis and certainly overnight in the Gaza Strip.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.